Hello, I'm Norman Swan of the Health Report on ABC Radio National. Heart failure is becoming incredibly common in Australia. When people have heart failure, they get breathless on exertion, breathlessness at rest, the body fills up with fluid, and it does shorten people's lives. But the good news is that there are treatments. Exercise, beta blockers, diuretics, water tablets, they all help, as well as watching your fluid intake and your salt intake. The problem is that not everybody gets the best possible care with heart failure, and the result is that their decline is speeded up. So WAFA, the West Australian Primary Health Alliance, is putting together a heart failure program across Western Australia, and that's what Learne is going to talk about.
Thank you very much.
So what are the statistics in Western Australia?
Look, I think there's probably 2 points. Our work, our data, highlighted that some communities had higher rates of heart failure than others. And so that notion of postcode became important, let alone access to general practice. And
so they've got more heart failure to start with?
Yes, they've got more heart failure to start with. And that could be due to the origins of, let's say, diet, exercise, diabetes, and also ageing in certain communities is exacerbated, particularly in more remote communities. People age earlier and younger. So our data highlighted that it nearly didn't matter where you looked across WA, heart failure per se was present. And what we know is that from the hospital data, many of those people, as you say, do attend emergency departments. And in and of itself, that can be traumatic, just having a hospital stay. We also know that heart failure, there are strong links between heart failure and depression. So it's not only people's physical health that matters, but also their mental health when they have heart disease. So we're also interested in trying to pursue not only good primary care responses, but ones that acknowledge that at times people may also need good mental health interventions to help them manage their lives well.
So what are you planning?
So what we're planning is to work with primary care providers, and in the first instance we are going to emphasise the higher need communities, because our belief is if we can work with clinicians in those communities, GPs and so forth, to establish multidisciplinary responses, so have the dietitian, have the exercise physiologist, have indeed the mental health care, that there are better ways or more comprehensive ways that we can provide care. I think the other thing is many people with heart failure don't necessarily recognise that salt intake, for example, matters. And simple things about weighing yourself regularly.
This is to monitor your fluid?
To monitor your fluid. And some of the innovations we're looking at is where some of that data can go straight to a practice.
And what's going to happen first?
What's going to happen first is twofold. Firstly, we want to work with primary care, general practice and so forth, what the data tells us. So what is going on in your community? What are the numbers of people going to hospital that you may or may not know are going to hospital? And what are the gaps in service provision that need to be addressed to start to develop a multidisciplinary approach?
And is this a WAFA only project, or is WA Health involved?
We are going to work both with State Health and also with our academic partners. So this is a tripartite sort of approach. We cannot do this without the engagement of the hospitals and the health system more broadly, and similarly we want the academic partners, because we know there is strong research that we would like to engage.
So you evaluate it?
Yes. This is a WAFA or a WA Primary Health Alliance led initiative. Why? Because it's a common problem across the state. The evidence is compelling about the issues for both individual consumers, for GPs who are trying to treat their patients, as well as presentations to hospital.
So you can forgive some people for being cynical, because there are parts of Western Australia where there isn't an exercise physiologist. How are you going to get beyond that barrier?
Yes. One of the important parts of the system for us going forward is telehealth. But the other thing is there's great evidence about community-led responses to exercise. Is it the walking group in the morning? Is it and to be fair, an exercise physiologist, you are correct, is not everywhere. But it's about the right solution for that community to get that outcome. and it's not going to be the same everywhere.
And step one is awareness, knowing it's a problem.
Absolutely. I think the first thing though is for people who may have or heading towards heart failure to ascertain what they themselves can do, and similarly then to work with their health providers about what makes sense in that environment.
So if you're a consumer watching this and your loved one's getting a bit breathless, get it checked up.
Get it checked and stop the salt.
And watch this space.
Yes, thank you very much.